so much for joining us for today's webinar. For those who don't know about who we are and what we stand for at SuperFriend, we're a not-for-profit whose ultimate vision is for all Australian workplaces to be mentally healthy. Through sharing our data insights, we strive to equip and empower leaders to create psychologically safe, supportive, and positive work environments. We're really excited about today's conversation. It brings together two independent national data sets that don't often share the same room. We're going to be talking about lag indicators reflective of harm that has already happened from the SafeWork Australia's workers' compensation data, and also lead indicators or early warning signs of potential harm from our own Indicators of a Thriving Workplace survey, now in its 11th year. So together, these two data sets give us the most complete national picture of where we are, but also importantly, where we need to go with respect to workplace mental health in Australia. So I'm Dr. Dianne Sheppard, Research Program Manager here at SuperFriend, and I'll be facilitating today. I'm delighted to welcome our guest speaker, Dianah Brown, Director of Psychosocial Policy at SafeWork Australia, the national body responsible for policy and guidance on work health and safety. And joining us also is our own Melanie Jeffress, Senior Research Communications Specialist and lead on our 2025 Indicators of a Thriving Workplace Key Insights report. That will be a feature of today's conversation. And we also have in the wings SuperFriend's advisory team, including our Chief Mental Health Advisor, Dr. Natalie Flatt, and the lovely Steph Thompson, both of whom will be moderating the chat and responding to as many questions as they can. So please ask them. Please join the conversation. So let's get started. To set the scene for this morning, let's start with what the national data is telling us. And Dianah, I'd love to start with you. So SafeWork Australia sits at the centre of our national workers' compensation data, provides us with information on claims from each of the jurisdictional workers' compensation authorities. Can you walk us through what that data is showing us right now?
So we're looking at SafeWork Australia's national data set for compensation-based statistics. So those provide insights into serious harm caused by workplace injuries and illnesses in Australia. And in 2023-24, there were 17,600 serious claims for mental health conditions. And that's an increase in 161% over the past 10 years. Those claims also cost over 4 times as much as the average for all claims, and they require nearly 5 times as long away from work.
Amazing. Thank you so much, Dianah. And I think the moderators are about to put a link into the chat that will allow you to explore SafeWork Australia's data set. So thank you. So the claims data is painting a pretty sobering picture. So next, I was hoping that, Dianah, you could walk us through what SafeWork Australia is thinking in terms of causes and contributing factors and what these insights are prompting you to do at a policy level.
The strong increase in claims for workplace or work-related mental health conditions could in part be explained by destigmatisation and an increase in awareness as opposed to just an increase in underlying prevalence. There is particularly relevant for mental health conditions where social stigma and workplace culture may influence whether or not a worker is willing to lodge a claim. So in 2022, we clarified the model work health and safety regulations to strengthen the framework around psychosocial hazards and preventing psychological harm, and we published the Model Code of Practice Managing Psychosocial Hazards at Work. Then in December last year, we strengthened the regulatory framework further by expanding incident notification requirements so regulators will have better visibility of exposure to psychosocial hazards and psychological harm that's occurred at work. But those legislative changes alone aren't going to be enough. Workers and workplaces need to understand what psychosocial hazards are and how to manage them to prevent harm occurring in the first place. That's a large part of our work at SafeWork Australia and the work of work health and safety regulators, including through webinars like today's.
Amazing. Thank you, Dianah. So this is really important context for employers, leaders, and those in work health and safety roles who I'm thinking will be in the audience today. So I'd like to pass over now to Mel. So these claims data gives us or provides us with the lag picture. So what are our lead indicators telling us? And can you explain a little bit more about why we are not seeing a shift in the National Thriving Workplace score in the past few years?
Yeah, sure. So the data that SuperFriend has been collecting through our Indicators of a Thriving Workplace survey over the past 11 years is telling a similar story to some of this workers' compensation data, and that is that things are certainly not getting better. Our survey collected responses from 12,000 Australian workers across 4 time points in 2025. Our data is nationally representative of the Australian workforce across industries, age, gender, location, and the data that we collect, it gives us a picture of what is happening in the workplaces currently. So more of what we would refer to as lead indicators. So we measure workplaces across a large number of workplace factors. So that includes a large number of psychosocial hazards, demographics, different types of organisations and health information as well. And we use our domain framework to summarise some of this into 5 key areas, or the 5 domains, which you're showing on the screen right now. And we average the scores of the 5 domains to calculate a national thriving score. So probably the headline finding from us this year is that our national thriving score has not changed significantly since 2024, and nor have any of the domain scores. We still see connectedness or relationships between workers as the highest scoring, and concerningly capability, which we measure as the skills and resources that workers have to support their own mental health, is the lowest. So what we measure, a score of 100 would be ideal. So there's clearly room for improvement. And the fact that things are not changing itself is a signal that targeted action is really needed. Just in response to that, I also wanted to touch on more of the human story of the workers that we gather the voices of. So every year we measure levels of burnout across the national workforce. And you can see that in 2025, this has remained high. So 45% of workers were reported that they were at risk or already completely burnt out. That's coming up to almost half. And this has remained consistent between 2024 and 2025. We've found through our research that burnout levels are associated with lower employee retention, lower productivity, and increased absences due to mental health. So really both SafeWork Australia and SuperFriend's data are pointing in the same direction. The levels of harm that we're seeing is unacceptable. Things are not improving on its own. The cost of doing nothing keeps growing.
Terrific. Thank you so much, Mel. So we're already through into our second segment of today, which will focus on the who is most at risk. And we can see that risk is not evenly distributed. So it's pretty clear that a one-size-fits-all approach won't have the effect that we would like it to. So to better understand risk and concentration, can I now hand it back to you, Dianah? So when you look at psychological claims risk, which industries or worker groups are standing out to you at SafeWork, and what is that prompting SafeWork to prioritise?
In terms of the workers, 59% of serious claims for mental health conditions are from females and 41% from males. And the largest number of claims is from the 45 to 54-year-old age group. The largest number of claims by industry is from healthcare and social assistance, followed by public administration and safety, and then education and training. Those industries stand out in the claims data with over double the claims of the next closest industry, with claims rates significantly higher than the all-industry average. The high proportion of women in serious claims data for mental health conditions is unsurprising when we see that the industries with the highest number of claims are also female-dominated industries. And we know workers' compensation data doesn't tell the whole story, and we look at other information and data sources as well as trying to we look at other data sources as well as trying to strengthen our own data holdings. So, for example, we'll soon publish data from the Australian Workplace Exposure Survey, which includes a module now on psychosocial hazards, which will add to our evidence base there. We're particularly interested in identifying where the needs are for guidance, and then we can target our resources to those. So, for example, We recently published a suite of resources on gender-based violence for the construction industry. I think we'll post a link to those ones in the chat if anyone's interested.
Great. Yes, that link is about to be put in the chat for those who are interested. So thank you so much, Dianah. And it's great to know a little bit more about the other collaborative work that you're doing in this area of psychosocial risk. I'd like to pass back to you now, Mel. So the SafeWork Australia claims data gives us an idea of where harm is concentrating as far as claims are concerned. So what does the indicators for thriving workplace data tell us about the workers we should be most concerned about, the higher risk groups?
Yeah, as you said before, risk is, of course, not evenly distributed across the workforce. And we also, similar to SafeWork Australia, we break down to different industries, and we find that some of the high-risk industries that SafeWork Australia are finding, for example, healthcare and social assistance and education and training, are also having very low scores across our domains and high levels of burnout. We're also seeing high risk in industries like retail trade, particularly through exposure to harmful events, for example, customer aggression. And we've also found transport, postal warehousing industry has also consistently been the lowest ranking industry when we rank the 19 industries by thriving overall national thriving score. I guess from when we can see in the SafeWork Australia data and ours that there are similar industries emerging, it's really good to see that consistency. And it gives us a greater confidence in these patterns that we're seeing. I wanted also to talk to this slide that you've put up, and there are about 3 high-risk groups that we've highlighted in our Key Insights report this year. So these are groups that are high risk of things like burnout and harmful workplace experiences. So the first one is customer-facing workers. Now, these are not just workers in retail. They can also be people working with the general public, like nurses, teachers, receptionists. And what we have found is that, unsurprisingly, they have significantly higher rates of harmful workplace experiences, such as customer violence, bullying, discrimination, and 34% reported at least one incident of violence, bullying, discrimination, or harassment in the past 12 months. And that was compared to 29% of our total workforce. In the current climate, we've also looked at those under financial distress. As the cost of living increases, more people are finding themselves facing financial hardship or challenges. We have 35% of our respondents experiencing financial distress, and of those, they are more likely to be completely burnt out. Workers really bring them whole selves to work, and what they're dealing with outside the workplace certainly influences their well-being at work.
Yeah.
And the final one are younger workers. And what we've done a lot of research into this group, the 18 to 24-year-olds, so the new entrants to the workforce. We've seen other sources like the National Mental Health Survey highlight that young people, 18 to 24, are experiencing significant mental health challenges. As many as 39% reporting a 12-month mental health condition. And this is reflected in our own data. 1 in 4 of them reported severe psychological distress, and over half of them are at risk of burnout.
Thank you so much, Mel. Some really interesting data points that really speaks to those high-risk workers. Dianah, I'm just going to give you an opportunity now. Do you have anything to add that really builds on these higher risk worker groups that have been identified by the SuperFriend lead indicator data?
Yeah. Interestingly, the risk faced by young workers under 25 aren't reflected in our workers' compensation statistics for mental health conditions. Those are dominated by the 45 to 54 or the 35 to 44-year age groups. But that doesn't mean that harm's not occurring. The harm from psychosocial hazards is often cumulative over time, so it's not always immediately visible. And younger workers may also be more likely to engage in casual work or have the mobility early in their career to just leave jobs if they're experiencing mental stress. It may also mean that the industries which employ younger workers, are also underrepresented in our compensation-based data. So it's really interesting to see those two data sets together.
Great, and I'm particularly interested in the point that you raised about psychosocial hazards, the impact being cumulative over time, which really strengthens the idea that we need to be working more in that preventive space. So I'd like to then briefly go back to you, Mel, and ask you whether there are any particular times of the year where we see the risk spike.
Yeah, definitely. Timing is really important when it comes to psychosocial risk. For that reason, we started gathering our survey data at 4 different times across the year. We started doing that in 2024, so we could collect data at each quarter, so March, June, September, December. And that allows us to track things like burnout and how it fluctuates over the year. So you can see on this graph, the dark blue is the national levels of burnout. You see a slight peak in June and December, but what you really notice is the retail trade in purple that has quite a significant peak in June and in December, which are really high pressure times for sales assistants and workers in retail trade. We also see in the pink colour, transport is fairly low across the year, but then it also has quite a high peak in December too. So we can use that to anticipate when workers will need the most support.
Great, absolutely. And I'd love for the audience to become involved at this point. So I'd love to know from you where you are seeing the highest concentration of psychosocial risk in your own workplace or workforce right now. And if you do put something in the chat, I'd ask that you also identify the industry that you're from, just so that we can speak to that a little bit more. Thank you.
I think it's interesting, someone's mentioned high risk for women, menopause, perimenopause, and we have actually been tracking over the past few years the number of people experiencing life transitions, with some of those amongst those are some of those. And we have found that life transitions and that whole bringing your whole self to work thing is definitely putting people at high risk because they're coping with so many pressures in their day-to-day lives.
Great, Mel. And I'm also seeing occupational violence and aggression in education, industry, vicarious trauma and health, frontline workers in youth justice, absolutely, community services, vicarious trauma again, farmers, mental health concerns of industry and workload. So a real mix, and that's really, really good to see coming through. Thank you so much for participating in that. So Mel and Dianah, anything in the chat there that you'd like to respond to? Is this what you expected? Was there anything that kind of seemed a little bit unexpected or new?
I think most of those coming up are industries that we've heard from and we're trying to target resources towards. I think agriculture or farming is a really interesting one because there's such a big overlap between personal life and work life for a lot of farmers. So that's a really, really interesting one.
Great. All right, we are running a few minutes late, but we're reasonably on time, which is amazing. I'd like to move into our third segment, and today that's going to focus on how we go about building thriving workplaces. So we now know a little bit more about what the national problem looks like and some high-risk groups. So we'd love to talk to the how now. So over to you first, Dianah, to start us off on the regulatory framework and the model code of practice. So for the HR professionals and employers in our audience, what does the model code of practice actually require of them, and where do you see the biggest misconceptions?
So the model code of practice, that's the managing psychosocial hazards at work. It takes the familiar risk management framework that we use for physical hazards and applies it to psychosocial hazards. So identify the hazards, assess the risk, control the risk, monitor and review control measures, and all of that underpinned by consultation with workers throughout the process. The requirements for psychosocial hazards are really similar to what businesses would be used to applying for physical hazards. And we actually encourage employers to apply their existing work health and safety systems and processes to make sure that those are capturing psychosocial hazards. The gaps we see around understanding of psychosocial hazards include persistent perception that it's an individual issue, and that's often perpetuated by relationship breakdowns that can occur before psychosocial hazards are identified and addressed. At their core, psychosocial hazards occur in the context of how work is managed and designed, the physical and human environment in which it takes place. Controlling psychosocial hazards is about making sure that workers have what they need to do their job well, and that obstacles in work processes or the work environment are removed and reduced, just like we do for physical hazards. So making sure they have the right resources and organisational support, eliminating things that might get in the way of them doing their job, like bullying or physically unsafe work sites. And we know that businesses, or particularly small businesses, are time poor. So we've developed a whole lot of resources on psychosocial hazards, which we're continuing to add to. For example, short industry-specific case studies, infographics, and those things designed to build on understanding of specific psychosocial hazards, so guidance for specific hazards that are coming up regularly. Work health and safety regulators also have some great resources that will assist in that area, as well as things like training sessions. So I think we've got a link to one of the Comcare websites that has their training sessions there, if anyone wants to jump in and have a look.
Great, thank you so much. Yes, that's being placed in the chat right now. So second opportunity for audience participation here, please. So please place your responses in the chat to this question. What is your biggest current challenge in managing psychosocial hazards in your workplace? So again, if relevant, please identify the industry that you're from. I see some coming through commenting about tokenistic aspects of implementing processes. Yeah. Having people actually reporting, and that is one of the biggest challenges that we do see. And I'll get you to maybe talk to that a little bit, Dianah, in a minute. What else are we seeing? Managerial bullying and micromanagement. So that is something that does come through in the claims data, I believe, as well, Dianah. All right. So in response to that, then, I've mentioned a few things that are coming through the chat. You would have seen a few things yourself. Do you have anything to comment on there, Dianah?
Yeah, there's a couple of things in there. One, bullying, and that's one that I think a lot of people are familiar with. So it's something they'll say, I'm being bullied, without recognising the underlying hazards that have led to that situation. So bullying itself can often be an inappropriate reaction to somebody else being exposed to psychosocial hazards. So if you think about when you've had a really high workload, if you haven't had the support to do it, the tools and resources you need to do the job just aren't there or aren't working, then that's when you get stressed and when you start to behave not at your best. So bullying is still completely inappropriate. We need to address the behaviour, but we also need to address the underlying hazards in order to control it. And that goes as well to that reporting point that you raised too. Bullying people recognise, so they'll often say, I am being bullied. At that point, it's almost, well, it's further down the track than we would like. If those underlying hazards are addressed, then we can stop it before the relationships at the workplace have deteriorated to the point of bullying. But it's also much easier, if you've given workers the language around psychosocial hazards, it's much easier for me to step forward and say, actually, I think we've got poor role clarity within our team. Can we address the role clarity? Than it is to say to your boss, you're bullying me. And by the time you've got to that point, the relationship's kind of degraded. You're unlikely to be able to salvage it.
Thank you so much. So again, staying on that front foot and trying to operate more in that preventative space is really important. Thank you, Dianah. So over to you now, Mel. So of relevance to this discussion is SuperFriend's 5-domain framework, and that offers a complementary lens, I think, to the regulatory requirements that Dianah has just outlined. And I should mention that this framework has just been peer reviewed and published in the Journal of Occupational Rehabilitation, which is a significant milestone for us. We're going to drop the link into the chat for those who'd like to explore the paper further. But Mel, I'd like to ask you, how does the domain framework help organisations go beyond compliance and actively build thriving workplaces?
Yeah. So at SuperFriend, our domain framework, it's not just a measurement tool. We use this framework as a guide for targeted action in the workplace. It really helps us to move from understanding workplaces and what's going on in the workplace to prioritising the most urgent challenges. You've got the slide up of the 5 domains. I'll just touch on them each briefly. So in leadership, we're looking at support from managers. Connectedness is another really important one, is about the quality of interpersonal relationships. Safety, the policies and procedures that protect people from harassment, bullying, discrimination and violence. And another really important one is work design and how work roles and tasks are structured. We've consistently found that connectedness is the highest scoring domain. That this is a genuine strength of workplaces nationally, and it can actually be a protective factor for things like psychological stress and burnout too. Concerningly, the lowest scoring one has consistently been capability. And this is a signal that not all workplaces are providing their workers with the sufficient skills and resources to support their own mental health. We also, of course, look at psychosocial hazards too, which are embedded within our domain framework. Based on our data, the most poorly managed hazards based on the data from 2025 have been job demands or workload, change management, and recognition. Job demands falls within work design. And when you strengthen work design, you improve the perceptions of workload and you're able to lower job demands. When we look at recognition, we tend to see smaller organisations perform better here. And this really aligns with our leadership domain. So when you're able to improve aspects of leadership, you have the opportunity to improve your management of recognition as a psychosocial hazard. And those are just a few examples.
Thanks, Mel. So the case studies in our Key Insights report really bring this to life. So we're going to touch on those now. So I'll pop up the slide. But Mel, I was hoping that you could summarise the 2 case studies in the report, each of which really brings to life and demonstrates how the 5 domains can translate into practical and often low-cost intervention.
Yeah, absolutely. So in this year's Key Insights report, we selected 2 industries, 2 high-risk industries, not to say that other industries don't have their risks, but as just 2 examples. We looked at transport, and in particular, we had a case study about a large logistics organisation. So workers in this industry tend to be working long, irregular and unpredictable shifts. They have little control over their work. And they're also very isolated with minimal access to support. Even things like accessing a GP appointment is hard due to their schedules. So in addressing these issues, the organisation introduced a structured shift to swap and protected days so that drivers could seek support when they needed them. There was also upgraded shared facilities to support rest and a real focus on peer connection through weekly check-ins between drivers and managers, and also a real effort to normalise conversations about wellbeing and EAP access and seeking help as well. So across our domains, we were targeting connectedness and capability, And these initiatives can really help to build connectedness and to increase awareness of the available supports so that drivers are not going it alone.
Great, thank you. So I believe on to the next one.
Yeah. So we also had one targeted to the retail industry as well. And it follows a small gift shop in a busy shopping centre leading up to Christmas at the peak trading time and high stress period. A lot of staff are casual workers who might be studying to young workers, and they might be forced to take on extra shifts, skipping breaks, and they're starting to deal with stressed customers as well and experiencing things like customer aggression. So the response could be a few things that are practical and low cost. So things like humanising the staff, things like name tags, just to put more of a human face to the staff so that people are more likely to connect with them. Simple things like signs about conduct, and a really targeted and timely training module on managing customer aggression. As well as revised break schedules and some shout-out recognition programs. So the outcomes of these types of interventions help to prevent burnout and emotional exhaustion, and help to see improvements across all the 5 domains.
Great, thank you so much, Mel, for sharing. I'm just going to ask our moderators to put in the chat a few of the SafeWork Australia case studies as well, and as well as the latest report. So a link to those 2 documents, which really complement what Mel has just spoken about, and could be of interest from the audience today. So thank you for that. So these 2 very different examples, different industries, different types of work, show that you don't necessarily need a large budget. But what you do need is the insights to understand, followed up by an evidence-based and targeted plan. So as we come to the end of this segment, a key message that has really come through is that managing psychosocial hazards, yes, it's a legal obligation, but it's only part of the picture. So thriving workplaces go further. They actively build the protective conditions that prevent harm in the first place. And I'd like to move now into the 4th segment, which is the final segment before our Q&A. So we're still doing really well with time, which is great. So hopefully at this point, we've successfully demonstrated what it looks like when lag and lead indicators are brought into the same room and talked about together. So the claims data from SafeWork tells us more about where the harm has occurred. The lead indicators from the indicators of a thriving workplace data tell us about where harm is heading and how to identify those touch points early. So both data sources point to the same conclusion. The national picture is not going to improve without sustained and targeted effort. And that includes efforts by the regulators, the employers, the managers, and the individual workers. Everybody plays a role. So the opportunity in front of us, and I think it's something that is really coming through just when you look at the audience today and the interest and the engagement, is one of collaboration and data integration. We're more powerful together. We can achieve so much more through collaboration. So there's so much potential surrounding the integration of data and data sets. We need to start thinking about forecasting what is coming. For specific industries, for vulnerable groups of workers, we can actually get on the front foot and invest in prevention rather than react to harm, which is going to be really important. So as we move into the Q&A, everyone, please start thinking and perhaps pop questions into the chat now. I'd like to take this opportunity to bring Dianah and Mel back briefly for their final takeaways for you today in terms of thoughts to inform employer action. So we've covered the scale of the problem, who is most at risk, and what the regulatory and measurement frameworks look like. So the question is now what we do with that. And so, Dianah, I'd like to start with you. If there's one thing you'd ask every employer listening today to take away, what would it be?
I think my key takeaway would be that psychosocial hazards are an organisational issue, not an individual issue or a resilience problem. They cause real harm. They need to be managed proactively and systematically at an organisational level, the same way as we do for physical hazards. I think by working together, the opportunity to share data and evidence, we can better identify emerging risks and preventative measures or the control measures for these. So I really love the opportunity to work with you guys. Thank you.
Thank you so much, Dianah. And over to you, Mel, for the SuperFriend single takeaway.
Yeah, so my takeaway would be the importance of knowing and understanding your workforce so that you can measure and find out what's really happening. When you have those insights and understanding, that's the first step towards effective action. Having the right insights can put you in the best position to implement preventive initiatives. And while it's obviously essential to consider organisational-wide risks, don't forget the human factor as well. When individual workers are listened to properly and consulted and involved in the journey, you're much more likely to create the conditions where people feel safe to speak up.
Great. Thank you so much, both of you, for today. It is time for our Q&A. So we do have a few minutes for questions. Please drop yours into the chat. And thank you also to those who have already provided questions when you registered. So I'm going to share the slides again. Just to show you two of the key themes that emerged from the questions that were shared during the registration process. Now, please feel free not to stick to these themes when you put your question in the chat, but we'd love to hear from you now. I will have a look at the chat, what's coming through into the chat, and then I will give our speakers a chance to respond. Thank you. I'm just going to read out a few that are coming through. Education of leaders. So that capability piece, making sure that our leaders and our supervisors are trained appropriately. Work-related violence and fatigue. Yeah. Lack of role clarity. Again, lack of reporting is coming through. Okay. Let's take a few moments then to respond. I would like to ask Dianah firstly to respond to some of those questions coming through, but also the themes that have come through in questions from the registrants as well. So whatever you'd like to speak to, Dianah, I think this is really about what's coming through from our audience and what you can provide in response to that.
Yeah, there's some really interesting questions coming through in the chat, so thank you for those. There's a couple of questions around the people at work tool and what else is replacing that. I think one of the reasons for people at work itself being decommissioned, part of it was needed a little bit of updating. Some of the questions there didn't cover things like sexual harassment or some of the harmful behaviours. So it did need a little bit of updating there. But also the fact that there is quite a few other tools throughout there now. So I think on the People at Work website, they were looking to put up a list of alternatives available. Otherwise, work health and safety regulators were putting together those lists. But there is actually quite a bit out there now, which is really, really promising, that people are starting to pick up what at the time when we developed People at Work, it was unique. There was a real gap in the market. But I think now we are starting to see some others coming through, including COPSOC. So it's an international questionnaire, and some work looking to contextualise that for the Australian environment. So there's an awful lot that's being done in that space, and there are some other resources available now. But I would say that one of the best resources you have is your workers. Talking to your workers, giving them the opportunity to raise psychosocial hazards with you, giving them that language, so the psychosocial hazards language, rather than focusing on the interpersonal issues that might be happening, giving them that language and doing a consultation properly is probably one of the most powerful resources you will ever have to identify psychosocial hazards and ways to control them. Workers often know what's frustrating them and how it can be fixed. So that consultation point is really important.
Amazing. Thank you so much. And Mel, a chance for you to respond to. Feel free to respond to anything you would like to, including those themes that really came through in the questions of registrants.
Yeah, absolutely. I love that Dianah, about giving people the language that they need, because language is something that's so simple and it just makes a huge difference. There's quite a lot of questions. I might address one of the ones you had up on the screen before. So there was a question about why is measurement and a strengths-based approach critical to prevent them, and that was from Nicole in the education industry. And I think probably echoing what I've talked about in this webinar so far, measurement is crucial because risk is not distributed evenly across industries, roles, worker groups. That's why we need to understand where the psychosocial risk is and what the priority areas are. And that's what's critical to preventing harm. SuperFriend, we focus on a strengths-based approach with our 5 domains, because the value and the importance of early intervention, and how workplaces can actively build the conditions that support workers to thrive.
Great. Thank you so much for leading us with that, Mel. We are right on time now. What I'd like to do is to share with you a link to our webinar feedback survey that will take you just a few minutes to complete. We would love to hear what you thought of today, and including some ideas for future topics, and maybe a part 2 for this one, because we really were pushed for time in the end. Please, if you can stay, do stay. I'm going to share some resources and a call to action as well. So if you can, I invite you to stay just for another few minutes. But for those who can't and who are, thank you so much for attending. We really appreciate your attendance today, your engagement. It's great to see so many questions coming through in the chat, and I hope that our moderators have been able to answer your questions along the way. And of course, we're going to share the video, and we're also going to try to respond to all the questions that we didn't quite get to in our response to all of the registrants for today's webinar. So thank you again. Thanks to our speakers as well, of course. So what I'd like to do now, for those people who can stay, we have a few more slides that will go through a few resources and leave you with some final thoughts. Okay. So if you haven't already read our Indicators of a Thriving Workplace Survey Key Insights report, Mel was the lead on this amazing piece of work. Please download. Once you do download and become a subscriber, you will have access to our free industry snapshots, which which are a big hit with those who want to know, a little bit more about their industry and where that is falling in terms of our benchmarking. So feel free to also peruse our list of academic and white papers. A few of the most popular are listed on the left-hand side of that screen. So we had a topic on neurodivergent workers, for instance, which was really, really popular. So as far as the call to action, and I guess it's really, it brings everything together, I think, from today, what our speakers have covered. We know that there are likely to be higher risk workers within your organisation that you need to better understand. And so the best approach to managing psychosocial hazards and those at higher risk in your workforce is to firstly listen to your workers. Dianah said that before, Mel has echoed that. You really need to know your workforce, understand which groups are at elevated risk and when, which part of the year in particular. So you can't protect what you don't understand. So of course, measure first in order to understand, and then act in a targeted and evidence-informed fashion. So SuperFriend's Thriving Workplace Index is an organisational level diagnostic tool that allows you to benchmark your domain scores at the workplace level and psychosocial hazard profile against our current national and industry data from the Indicators of a Thriving Workplace survey. So benchmarking that really provides employers and managers with the insights that are needed to put that targeted and evidence-based management plan in place. And really the third thing is that think about how you might encourage a culture that promotes those open lines of communication, that encourages people to report, that encourages people to speak up. We are only just recently starting to measure psychological safety, and we've already shown within our data that psychological safety, or the extent to which workplaces show higher levels of psychological safety, can be a protective factor for outcomes like burnout and psychological distress. It is one of the keys to a thriving workplace. So one where an environment where people or where workers feel safe to speak up, so that then the risk can be identified early before they escalate. And I'd like to then move on to some SafeWork Australia resources. So some of the links have already been shared within the chat for today's session, such as the retail case study and the link to the most recent SafeWork Data Insights report. Most of the resources listed can be found if you navigate to the SafeWork Australia website and you look under the data and research or resources and publications tabs. So I encourage you to do that. There's a wealth of resources there. Okay, well, I'm going to stop sharing. So the links to all of those resources, including the video from today, will be shared to all of the registrants in the follow-up for today's webinar. Again, I'd really like to thank you all for attending, and thank you to our speakers, Mel and Dianah. You did a great job. Thank you so much for bringing your expertise today. And thank you, again, the audience, for engaging in this very important topic that we hope is starting to make a positive impact on the mental health of Australian workers. Thank you so much.
Thank you. Thanks for your facilitation, Di. It's been wonderful.
Pleasure.
Thank you, Di.
Thank you.